Community paramedicine is an outreach to our patients and our community that once the patients are discharged from the hospital, our paramedics, which are trained as community paramedics, go out into the patient's home and visit with them to ensure that that plan of care from the hospital is continued on to the home. The process for community paramedicine is that the patients are, for the majority, are identified during their hospital stay. The hospital, usually a case manager, nurse navigator, will reach out to that patient and ask them if they would be interested in participating with community paramedicine. And at that point, our community paramedics will go into the hospital and visit with the patient, introduce themselves, let them know that they will be coming into the home to visit them once they go home. And from that point, the patient is met in their home by the community paramedic.
I've been suffering with congestive heart failure for some time now, and I was suffering with really bad edema or fluid retention. And I got to the point where I was really close to death. And so they put me in intensive care. The day they discharged me, said I would have these people come visit my home. That's how I was introduced to them.
After the patient is seen by the community paramedic on that first visit, they do an electronic medical record, a health note, so to speak, on that individual patient, but they also call that patient's provider so that they can let them know that during the hospitalization for the patient's pneumonia, such and such medications may have been changed. And that's very key because a lot of times it may be 10 days or 14 days before the primary care provider has an opening for the patient to come back into the office to see them. And with the community paramedics being in the home quickly after discharge, it helps with that total care coordination of the patient's overall health. Community paramedicine is different than our regular EMS service because the community paramedics will arrive to the patient's home in not an ambulance, but a SUV. They are going to be visiting that patient on a regular scheduled time throughout the patient's enrollment in our program. It's not going in and treating you, starting an IV, getting you packaged up and ready to transfer to the emergency department for further treatment. The community paramedics are going to go into the patient's home, they're going to assess them, they're going to review their medications, they're going to sit down and they're going to talk with them. So the visit times are longer and the patients really get to know the individual community paramedic that is assigned to them.
They brought an EKG machine, gave me an EKG right in my living room, and was very helpful with, checking my vitals daily, which I do to this day. I think she arranged for me to get a blood pressure meter, and if I didn't have that equipment, I couldn't keep this log of vitals, and it was there like the next day. I mean, that was very impressive.
The CP is a patient advocate. That's our biggest role in health, is being the patient advocate. So it's being able to connect them to the resources that they need. There's a lot of people that are still utilizing emergency rooms as their primary care physician, and that's just a flawed system. We're the second most rural state in the country. Our biggest health care crisis, in my opinion, is access. And I think with community paramedic programs, it allows access much more readily than what we have now. Paramedics in general, it's about taking care of their communities. And these people are our communities, and we care so much that we want to make sure that they're taken care of at the highest level that they need.
The beauty of it, it's in-home. You don't have to get dressed and get in your car and go somewhere. Just the fact that she was there for me, and I had a phone number. I could call them, I think, 24/7. It was great.